So today I'm going to be treating shoulder bursitis, subacromial impingement syndrome with the Endolaser 120. This is one of the situations where I would normally come from the side of the shoulder if the symptoms were in the centre of the shoulder. If the symptoms were at the front, I'd come from the front of the shoulder. I'm going to be using a single 800 nanometer laser probe today, so just one diode. There's no built-in clinical protocol for this treatment on the Endolaser 120, so we're going to come in and manually set the laser to do this treatment. It gives us the option of points per centimetre squared or milliwatts. I'm going to go for points per centimetre squared. You see here it's asking me how many points I want to do. Now, because this is a single probe, we can do 1, 2, 3, as many points as we like. Actually, I'm going to go for 4 and press OK. That means I'm going to have to move the laser 4 times. So I'm going to do a spot, and then another spot, and then another spot, and another spot, and that will be the 4 points because it's a single laser diode. We're going to aim for somewhere around 3 joules per centimetre squared. I'll show you why now. We're going to get 12 joules in total, which is really what I want. So at 4 spots, I'm doing 3 joules, and 3 times 4 is 12. It's actually set the laser probe to 500 milliwatts. I don't want to use 500 milliwatts, it'd be too high. I'm actually going to come down to 100 milliwatts, and that's going to give me a treatment time of 2 minutes. That's a total treatment time of 2 minutes. So you'll see that we do 30 seconds, and then 30 seconds, and 30 seconds, and 30 seconds until we've done the 4 spots. So we'll go to the patient now and apply this to the patient. Seen from the patient perspective for treating the subacromial bursa, you really want to try and focus your treatment where the pain is worst. So if the pain is worst in the centre, you'd do 4 spots in and around the centre. If it's at the front, you would do more spots around the front, and same for the back. The tendency is to come up onto the bone. Obviously the laser is going to have trouble getting through the bone, so you're better to come a little bit lower and sort of point upwards towards the gap and the bursa. We're going to be doing 4 spots here. So let's begin in the centre and then we'll work our way out. So this is spot 1. The bursa is much easier to get at a slightly upward angle. You don't want to lose too much of the energy into the tissues around it. That's spot 1. Spot 2. Remembering that in most people the bursa contains individual pockets, anywhere from generally accepted 1 to 8 pockets, and most people don't have 1 or 8. That's spot 2. Spot 3. 1 or 8's very rare. Most people have somewhere in between. So if one of the pockets at the front is more inflamed, it's worth doing more treatment towards that. If one of the pockets in the rear is more inflamed, it's more useful to do treatment towards the rear. You'll find that in most shoulders, the problems tend to be at the front or in the centre rather than towards the back, but it is possible. And that's the end of the treatment. Back at the laser now, we'll start the treatment, and you'll see the time start to count down and the number of joules start to count up. 2 minutes is not a long amount of time to do a laser treatment for at all. On the previous generations of lasers, it wasn't unusual to do 5, 10, 15 minutes of laser. They've just become more powerful over the years. So the evidence in and around treating the subacromial bursa is very good, and that's the first spot done. We'll move to the second spot, and just as an anecdote, I really like this treatment for subacromial impingement syndrome and bursitis. So for my patients that have subacromial bursitis, whether that's with or without rotator cuff pathology, the first thing I would reach for is the laser. 100% reach for the laser first. It's a great treatment for bursitis in the shoulder works very well. That's the second point. So we'll move on now. We've got 60 seconds left. It works very well for patients. The effects can be seen usually within the first few treatments, and in my experience at 5 treatments, most patients are feeling significantly better. So a very good treatment for subacromial bursitis. In the literature, people pretty much say it's equivocal to a steroid injection in the shoulder, some sort of. That's the third point. We'll do the fourth point. Some sort of steroid injection therapy in the shoulder. Steroid injections in the shoulder are very popular still. The lasers in the literature compared to it about the same. So a very good treatment to choose, non-invasive, fairly straightforward, which a lot of patients like. The only issue is they're going to have to turn up for a few sessions. I would always give laser therapy for the end of the treatment, subacromial bursitis in conjunction with some sort of exercise therapy, and during the painful period I would always choose an isometric exercise to do, or isometric exercises I should say to do. As the patient becomes less symptomatic, then you can move on to isotonic exercises, isokinetic exercises, but always start with isotonic if they're particularly symptomatic until the laser and the exercise starts to get on top of it.